Good morning, Karen.
Morning.
Welcome to Pillow Talk.
Thank you. Thank you for inviting me.
Such a pleasure. Karen is the medical trainer for Melle, and I cannot wait to have this conversation with you about skin today.
Stunning.
We asked our clients to let us know if they had any concerns and that type of thing, and I feel there's no one better to answer this than you.
Thank you. That's such a nice compliment.
And also welcome to our new space.
It's beautiful.
Yeah, so we set up over the weekend. So this is our first ever Pillow Talk in our new Hello Hair for Always salon. So happy to have you here.
Stunning.
Karen, should we get cracking because we've got a lot to discuss? People are clearly very curious. I'm not sure if you get this request often or not, but somebody's asking that she would like to lighten her skin. She feels she'd look better if it weren't so dark. Is there a safe option to do this?
Okay, so skin lightening or skin whitening is very contentious. We were actually chatting about it in the office last week. And yes, there are a whole lot of things that we need to look at when we look at skin lightening and why people want to do it. The challenge though is that when you are actually whitening your skin, so I'm not talking here about removing hyperpigmentation. So hyperpigmentation is generally where we have darker marks that are darker than the background to your skin. And of course, there are lots of treatments for that. But here we're talking about where I take your skin and I make it much lighter than what your genes tell us your skin would be. And the challenge there is twofold. The one is if we remove pigment, so we talk about depigmenting treatments, we are walking on dangerous ground. Your genetic material tells your body to create pigment based on how it can best protect itself. Now, if I fiddle with that, I'm taking away your ability to protect, and I'm putting you at risk for skin diseases, but more importantly, at risk for skin cancers. So when you are doing these lightening treatments, you're going to have to up what your sun protection is like. And we're all exposed to sunlight. So that's a challenge. The second challenge is that generally, if we're talking depigmenting, the ingredients that are used are sometimes dangerous. So I would not suggest that someone look at skin whitening as such. With our products, we treat hyperpigmentation. And what we talk about there is to take the facultative, so that overproduction of pigment, down to be at your constitutive level. So constitutive is the amount of pigmentation that you were born with. So the short answer is there probably aren't safe alternatives to whiten your skin. There are definitely safe alternatives to treat hyperpigmentation. And I would say be careful of what you're using, and also be careful of what you get marketed at. The best thing to do though is to wear sunscreen, because in the end the sun is what is darkening your skin in those sun exposed areas. So we can take you back to what your tummy color is if it's not sun exposed, if you don't wear a bikini, but we shouldn't go lighter than that.
And I imagine brightening, so it would be more brightening
yes,
rather
definitely.
than lightening.
Yeah.
And you were talking about stripping away the pigment, and then therefore that under layer is kind of exposed. It's the same with hair. We bleach.
Yes.
And what we do in that process, we're actually stripping away protein and moisture. So like with all of our clients, we say, if you're going to go through a process like that, then you need to put back in what you're taking out. But I think, skin lightening, so a bit of a no from you. Skin brightening, working on your pigmentation, a safer option.
Working on hyperpigment, yes. So as long as we're not fiddling with what your genetic level of pigment is, I'm not worried about that.
Okay.
But it is about, don't fiddle with your genes.
Although we all like to we like to kind of change what we have. Nobody's really, isn't it? Don't know why it's like that, but it's like that.
Yes.
Okay, so thank you for that.
Absolutely.
We have another question, which is, I think it's quite common. My skin is super oily. What product should I use that will manage the oil without drying my skin out?
Okay, so there you have to look at balance. Now, when we look at, this is a question we get a lot. And what we always educate our therapists is that sebum and lipid bilayer are two different things. So sebaceous gland produces sebum, and that's what you're feeling as the oiliness on your skin. Well, in between your cells, you've got another type of lipid, and that's called lipid bilayer. Now, when your skin feels dry, it's because that lipid bilayer has been damaged. So we need to go and look at ingredients that are not going to strip lipid bilayer, but that will control what the sebaceous gland does. So we at Melle, we use quite a bit of salicylic acid because it nearly mops up the lipid bilayer or the sebum. We wouldn't want to mop up lipid bilayer, but it mops up the sebum. And then what we also use are ingredients that can actually make the lipid bilayer shrink a little bit. And so there are definitely nice ingredients out there, but the big thing is don't over cleanse, because if you're over cleansing, because that's what I find a lot of people do, is they go into these hectic cleansing routines because I need to get this oil off. And what you're actually doing is you're stripping the lipid bilayer, which means that you then feel the sebum more. So it is about creating balance. We have one product at Melle that I love to suggest for oily skin, and it's actually a product that contains a little bit of probiotic, a little bit of salicylic and alpha hydroxy acids. So those moppers of sebum, but it also works on making sure that the lipid bilayer is intact. And it also has an anti-inflammatory, which is important in acne, but that's something that people could use in general. The product's name is Skin Essence Clear, if you are wanting to talk to your skin therapist about that.
Yeah.
But there are very much tools that we can use. And check with your therapist. She probably has an arsenal of treatments for that, because it is a very general question. So it can be done.
Okay, well, that's good news. I think it's common, and I think I might suffer from the same thing.
Yeah.
So I'll definitely look into that product.
Fantastic.
Thank you. Okay, so this is actually my question that I've added here. It's more of a statement with a question to follow. So it says, I've decided not to have Botox. I went through the traumatic experience of having breast implants that my body rejected. So I had to have a double capsulectomy, which was not fun.
Oh no, that's very traumatic. It's more traumatic than having them put in the first place. Yes.
Really, it was not fun.
Terrible.
Yeah, and the pain and So I now fear putting anything unnatural into my body. However, I'd like to look young and fresh along with all my friends. What would be the best course of action for me, in your opinion, in terms of products and a skincare regime? So, I mean, I'm looking for the heavy arsenal that's going to keep me fresh-faced and wrinkle-free without the need of Botox.
So let's look. I'm never going to try and convince someone to get Botox. I think that Botox is definitely a personal choice. I think that it is something that, if you have a lot of expression on your face, it's something that you might want to look at, but it's a personal choice. So there's no positive or negative with regards to Botox. So that just in the first place.
Yes.
On your skin, there's a lot that we can do. But let's look first at, so what we want to do is, firstly, we want to protect what you have. And for that, you need to use sunscreen daily. And you need to look at using antioxidants on your skin. All right, so those two things are generally how we protect what you have. Okay, and also where you, for instance, working with a hairdryer a lot, you actually want a sunscreen that's got a heat protector in it. Like you protect hair from heat as well, we can actually protect your skin from heat as well. So we've actually got a product that does that. Wow. So that's protection. Then what we can do is we can actually rely on your body to help us to fix itself. So from a treatment and in office, we could use chemical peels, where we're really looking at the texture, the superficial texture of your skin. And then we also love microneedling. So microneedling really gives us phenomenal treatment from the point of view that it looks at the texture that's inside your skin, where you've got a little bit of elastosis. It helps with pore size, definitely helps with lines and wrinkles, fills them up again, improves elasticity. So that's definitely something that I would look at. And those treatments are a microneedling treatment you do every 6 weeks. Peels you could do a little bit more often. So from an in-office treatment, that is what I would look at. And then from a product point of view, I would look at, in your case, we would look at reversing the signs of aging. So we're already looking after your sun protection and protecting what you have, but then we can mobilize your skin as well. And at Melle, we love growth factors. So we have 2 types of growth factor products. That our DermaHeal range, where we're literally putting in a molecule that your skin recognizes and that your cells will respond to, and we're reactivating your cells. So they'll rebuild your skin.
Wow.
And we've got there's also my magic in a bottle. We talk about an elixir, is actually a growth factor or a growth factor complex that we get from a stem cell. So it's called stem cell conditioning media. And that, if you can get one of those a year, that changes your skin phenomenally, and it just triggers everything that your skin needs to restructure itself into the future.
Amazing.
You could use it constantly, but you could really boost your treatments with that kind of product.
And is that a serum?
That's a serum.
Okay,
yes.
that you could use every day?
You could use it every day. You could also mix it. So if you have, it depends on what the person's skin looks like. So if you, for instance, my chest is always a problem because of sun exposure. I was a wreck for many years, so that's where you get hammered. I would use it on my chest, do it for a month, and then I just continue with my routine. So you can do it area specific, or what you can do is you can mix it with your actual moisturizer and then put it on so it lasts for a little bit longer.
Okay.
So it's a multi-use serum.
Sounds like a miracle in a bottle.
Oh no, definitely.
Yeah.
This is, and I know I am biased here.
Yes, no, but
this really does work.
I've used Melle's products for years, and I find your serums to be spectacular.
Yes.
So I'm not sure I've used the one you're mentioning now, so I can't wait.
It's a recent launch. We launched it last year. It's been on the market for a year. Yes.
So I'm definitely investing in that.
Yeah.
And it's so funny because as you speak, I relate on a hair level to everything you're saying. You know,
hair is an extension of skin.
Exactly.
Yes.
And we always say nurture what you have, you know, rather than buy a pot of a once-off miracle something. It's the little things you do consistently every day that really makes the biggest difference. But then there are these lovely things that have been formulated really to solve specific problems.
Yes.
And so it's nice that we have these solutions.
Yeah, and there's a lot in the market that you can do. So there are, I mean, we could add vitamin C's and vitamin A's as well. There, you know, it's not, we don't, what I'm saying is that you don't, it's, keeping what you have. You don't need to go for plastic surgery every 10 years and not using, use aqueous cream on your skin.
Yes.
It is about consistency, and you can definitely keep your skin very young.
Okay.
Yeah.
Okay, good. Good to know.
Stunning.
All my friends call me a pioneer or a pilgrim because I've had natural birth 3 times and I won't get Botox, and they're like, there's something wrong with you.
Living for West?
You're living for West. How did you avoid this? Okay, so let's move on to the next question then. It says here, please help me to get my teenager onto a skincare range that will assist her with outbreaks and nurture her skin from the get-go. Budget friendly as possible, please.
Okay.
Yeah. And so, I'm a teenage mum, mum to, not a teenage mother, a mum to a teenager. And I have the same. I mean, she's just asked me now she needs to top up her skincare.
So at Melle, here I'm going to talk product.
Yes.
So at Melle, we have a range called Acneval. An oral supplement called Acneval Plus. And then we've got a range called Clarity. Now, I think it's important that you just, if you are going to a skincare therapist, just take your daughter so that she can just check her skin. Because there are different levels of acne. There are different ingredients. So it depends on, is she getting blackheads or is she actually getting pimples? We would change the products that we are using.
Okay.
So if you have full-blown inflammatory acne, so we see it a lot in boys where their skin's red and they've got these big carbuncles on their faces, and you've got the pustular and papular acne. We need to there go onto the full range of Clarity. But if your daughter is just seeing the odd breakout, we talk more about acneiform eruptions.
Okay.
Then you could get away with using Cleanser and Acneval Plus, for instance. But it really does depend on what your therapist thinks that the skin needs.
So get a diagnostic first,
yes.
and then.
Yeah.
So what you're suggesting is it would be the same as coming to a hairstylist first before you go to the shop and buy something, or you need to have a professional check the
Yes.
skin, and from there give you the tools. But you've got these awesome ranges.
Yes.
And you were saying the one is a supplement.
Yes, so we've got an oral supplement, which is zinc and vitamin B3. So it's all about calming inflammation, because we know that acne has a big inflammatory trigger. And then we've got topical range, so creams. So we have a day and night, a cleanser. We have a spot treatment. We also have a back treatment. But just to get back to working with a professional, is that skincare therapist is skilled to see where, because sometimes we need to go medical route, but she'll be able to help you. And if she sees your daughter or your son, when they start getting breakouts, and she does a proper assessment, she can see them in a year or two again if there is any change, and she'll actually know where to go with them.
Okay.
So it is very much, acne is one of the things that I would really partner with a skincare therapist with, because we don't want that devastating effect of scarring on our children's skins.
Yeah.
But their skins can change drastically, and if your therapist knows where they're coming from, it's much easier to manage.
Okay.
So some people will need, some teams will need to go on the full program, and then your therapist will also help you, and she'll look at your budget and she'll go, okay, let's start with this and this, and then next month add that, and next month might be a big month, so save for, so she can plan a routine for you.
Okay.
And then if your child needs chemical peels or needs other treatment, she can also help you with that.
Okay. I think that's very sound advice, and I actually think that anyone with a teen, they would feel so, I don't know, special and spoiled knowing that someone's with them on their skin journey.
It's definitely
Because it can be quite, I mean, it's an uncomfortable time.
Yeah.
You know, you're coming into who you are, and you're so self-conscious.
And it's no longer just about doing deep cleanse facials and extracting every little pore, which is traumatic. We actually have treatments that are very comfortable. I talk about chemical, not exfoliations, decongestants. Okay, so we actually use the peel to remove the congestion.
Okay.
Not a decongestant, but yeah.
Okay.
You get my joke.
Yes, got it. Okay,
Yes.
thank you. Well, thank you.
Chemical extractions rather than doing them physically.
Okay.
So we're actually using a peel to get rid of so we're not climbing in there.
Yes.
Because I know my daughter also had severe acne. And the first 2 times she went to therapists, they literally climbed into her skin. And she saw for weeks afterwards, so she refuses to go back. Which is also not something that you want for your child.
Yeah, that's true. Okay, good to know that we've got some gentle options to ease them in.
Definitely.
Well, thank you whomever asked that, because that's very relevant for me too, so now I know. Okay, so I'm sure you get this a lot, and you've spoken about sunblock today already, but somebody is asking, is sunblock on my face really a requirement? My skin always feels oily with sunblock. I use a BB cream with SPF. Is this not enough?
Okay. Yes, you need sunblock on your skin, or sunscreen. Okay, so we in South Africa, the reason why we age, and that might be liney, wrinkly, saggy skin, or pigments, so depending on how dark your skin is all related to the sun exposure, and we are constantly exposed. So it's not just about the sun exposure when you're lying on the beach. It's about you're driving, dropping your child, waiting on the rugby field. Every day we're exposed to sunlight, so you need to wear a sunblock or a sunscreen. If your BB cream's SPF is 30 plus, so they're tinted sunscreens, that's adequate.
Okay.
All right. So look at an SPF of 30 plus and go and find a sunscreen that your skin likes, because there are so many versions at the moment. There are sprays, there are the BB creams, the tinted sunscreens, there are lotions, there are creams, there are sunscreens that feel like primers. But what you need in South Africa is you need an SPF of 30 plus, and that's for your in and out. If you're going to be outdoors, I would definitely look at 50 and up. So 50 plus is our maximum in South Africa, but I would definitely look at an SPF of 50 if I'm going to be on the beach.
Yeah.
We need to protect. And it's not just about aging, it's also about skin cancer. We see more, we're still winning, we're winning the race. We're above, at the moment our skin cancer incidence is more than Australia. Australia and us are head on head.
Really?
But Australia are very good at wearing sunscreens, wearing hats, staying out of the sun, wearing protective clothing. They've got a big drive going on.
Okay. So we need to bump up our awareness and really make sure that, so you guys were kind enough to send me an SPF, which I love. And I must just add, it doesn't make me feel oily at all.
Yeah. Sometimes it is also, I know with our SPFs, if you are layering a lot of cream, so if you're going to put on a vitamin C serum and a hyaluronic acid serum and your eye cream and your moisturizer, just give it time to just settle. I'm literally talking a few seconds.
Between layers.
Yes. And then put on your sunscreen and just go and brush your teeth before you put your makeup on. Because I know that can also create a little bit of oiliness. And also if you put your makeup on too quickly, it does sometimes give you, in Afrikaans we talk about it frummel. It makes porridge with your makeup, you know.
Okay, yes.
And that's not comfortable, but it is just give it time just to settle.
That's good advice. I'd never thought of it
just
like that.
Run,
we do.
on.
You know what the
day.
morning routine is like.
Yes.
I think, these days. So it's good to know. Okay, that's great. And it's just a few seconds. We don't have to wait for hours and hours.
No, you don't have to get up at 4 to put your creams on before you put your half an hour before you put your makeup on. No, that's not necessary.
Okay, that's lovely. And then so another question, and I'm also curious about this, is do I really need both a night cream and a day cream? I don't understand the difference. Can I not just use a really good serum as a moisturizer? So it kind of sounds like two questions in the same thing.
Yes.
But what I hear is that somebody is actually just wanting a very simplified routine.
Yes.
And so
it depends on the range. Generally, what we do is we make our day creams a little bit lighter and our night creams richer, and we might use in our night creams, we might add vitamin A's, which we can't use during the day. So it depends on what range you're looking at and what you're hoping to treat. So if you are going to use a vitamin A, you have to have that at night. Then you can't use it during the day because vitamin A's during the day actually irritate your skin.
Okay.
They create a higher risk for burning in the sun. And they can be quite irritating. So we don't want to use vitamin A's during the day. Not in South Africa, definitely.
Okay.
Maybe if we were living on the poles, maybe yes. But no, all right.
Okay.
The second reason why we split them is that during the day, as I said, you're going to use a sunscreen, so you have a lighter cream. And at night you can add something a little bit more richer because you're not putting a lot of creams on.
Okay.
So that would be another reason why we sometimes use a day and a night. Though, if we have ranges where you can use your day cream night and day, and they don't have retinoid, the product doesn't have a retinoid in it, so you can use it at night and you can use it, duly. So it very much, it's related to what your range looks like.
I see.
Number one.
Yeah.
Why can't I use a serum as a moisturizer? In most cases, and especially at Lamel, our serums are made to deliver a high concentration of ingredients into your skin. So it's not really replacing that lipid bilayer that I spoke about earlier that's going to trap the ingredients in the skin.
Okay.
So it's about, we need to create that, we need to have a moisturizer as well as a serum.
Okay.
Generally. Some people can get away with it, but I would
Yes.
suggest that you use your serum and then a moisturizer on top.
Okay.
But also ask your therapist, because there are lots of products where we've got combinations of ingredients that are just, you have a product that's loaded with growth factors and moisturizer and vitamin A, or a nice vitamin C that's lipid soluble. So we can simplify it. And
I think it's skin dependent.
it is definitely.
It's like, again, I'm thinking of hair. There's some people where just a really good shampoo and conditioner is enough. When there's others, we need the masks, we need all the extra. So there's hair types, there's skin types.
Definitely.
So again, getting your consult from your therapist rather to answer these questions than guessing.
Definitely.
Yeah.
Ask your skin therapist about it. Also, discuss what your needs are. Sometimes therapists they don't try, but they want to do the best for your skin, so they can overwhelm you a little bit. You're allowed to say, sorry, honey. Okay.
My line is not today, Satan.
Yes, I can't cope with all this stuff.
Too much.
Please, I'm a little bit overwhelmed. I don't know which can we start simply, and then she'll start simply for you. So it is, talk to your therapist about it. But it's not a rule. So there's no rule that says you have to use a day and a night. I would say there is a rule that follow a good routine morning and evening. So in the morning we want to get a little bit of antioxidant, we want our protection during the day. At night we're washing off the day. And we're preparing, you can put a lot on your skin at night because your skin's not going to sleep. So we can make our skins work at night while we're sleeping. So as long as you're following a routine, as long as you're doing it twice, and as long as you're taking the makeup off, because that of course also, it creates challenges for us. So yeah.
So just bridging out from that, obviously you can see the slip behind us, which you have as well.
Yes.
So one of our go-tos for that is the theory that satin doesn't absorb moisture like cotton. So it also, what we say is it helps to keep and lock in your moisturizer or your night creams.
Yes.
Because, you know, we can have this wonderful routine and put all this lovely stuff on our face and go to sleep, and you're sleeping on
cotton. In your pillow,
Cotton, also known as cotton.
Cotton.
Which is naturally absorptive, and it's just being pulled off of your skin.
Yes.
So
definitely agree with that.
Yeah.
So I can't wait to sleep on mine. I kept mine in its box, so it's pretty. But I can't wait to sleep on it. And also from a sleep line point of view, when you're sleeping on cotton and it folds your face, well, silk will allow it to just glide. And so we can definitely endorse sleeping on a silk pillowcase.
Awesome.
So, yes.
Awesome. Once you've tried it, I promise you, it becomes so difficult to even. I mean, I can't lie in a scatter anymore because I'm so conscious that it's cotton and what it's doing to my hair and skin. So I just have satin all over the show. When you travel as well, take your slip with you because you'll notice a difference. Even in your blow dries, when you wake up, your blow dries, they don't, as you say, the cotton is a bit more rough. So the friction rubs up the cuticles, so it impacts your hair, it impacts your skin, your crease lines. So definitely, that was a question that I was actually about to answer. Does it really make that much of a difference? And the answer is yes.
Definitely.
It's a little thing you can do to make a big difference.
Wonderful.
Yeah.
Supporting what you're doing on your skin.
Yes. So, Karen, thank you for that chat about skin.
Absolute pleasure.
So informative for me, and I hope for so many other people. We'll share details of whom they can contact. I'm sure everyone's going, which therapist would you recommend based on this conversation? And we can list the products we chatted about today as well.
Stunning.
Okay.
Wonderful.
Thank you.
Thank you.
Have a lovely day.
Tamsyn. You too.
Bye.
Bye-bye.